Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sidis. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts, we've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. So in keeping with our prostate cancer awareness for September, UroPatient is proud to bring you more information on prostate cancer awareness. Today, we're going to talk about why you should get tested, prostate cancer testing. So let's get into that right now. Welcome to the show, everyone. So prostate cancer, get tested because early detection saves lives. So it's really important to detect prostate cancer early on. You know that if you catch prostate cancer early before it goes anywhere, it's confined to the prostate, the 5-year survival rate now is close to 100%. But compare that to when it spreads to a distant part of the body, such as the body, the bones or lymph nodes, the 5-year survival rate drops significantly to about 30 to 35%. So regular screening makes a lot of sense. Prostate cancer gets a bum rap because everyone says, oh, it's such a slow growing tumor. Most of the times it is, but not always. Now, what are the prostate cancer tests that we are talking about here? Simple. It's a blood test and a digital rectal exam. Most importantly is the blood test, the PSA, because PSA can detect prostate cancer at a very early time when it's very and microscopic, where digital rectal exam can feel a bump or lump that's usually a tumor that's gotten a little bigger. Now, it doesn't mean that just because they picked it up on the rectal exam that it spread anywhere. But again, the PSA is your more sensitive. Unfortunately, it's not a perfect test. It does have some errors where it picks up things that aren't cancer. You can check out episode 15 on our UroPatient podcast. Go to our UroPatient.com website to learn more about that, because you'll see what other options there are as far as testing goes about the PSA. So who should get tested? Well, if you're a man and you're age 50, definitely should be getting a test. If you haven't had one, I highly recommend it. Now, that's only if you're at low risk, meaning just there's no other medical problems. What are some of the risk factors? We talked about those at our last episode, but again, if you have a family history or if you're African American, your risk is higher, so that we recommend screening as early as 40 years of age. So if you haven't had it done, get out there and get it done. Always talk to your doctor. They're going to be your best guide. Now, what frequency should you get it? Now, this has changed. Back when I started, PSA first came around, everybody got a PSA once a year. That was no matter what. It was like doctrine. But we don't need to test everyone that often. And with an average risk, not a high risk person, every 2 to 3 years after the age of 50 is all you need, just to keep things monitored. But if you're in that high risk category, then once a year is suggested. And again, starting it earlier. Now, your frequency may vary depending on what they find. Always follow your doctor's guidance. So, well, you had your PSA done and it was elevated, and that led to a biopsy, and now you're diagnosed with prostate cancer. So what happens if you're diagnosed with with prostate cancer? Not time to panic. Don't start spending all your money. There's going to be further testing ordered to look into the stage of your cancer to get a better idea of what we need to do. Some treatment options are active surveillance, which means all they do is watch the PSA, sometimes rebiopsy, and just check to see that it's not progressing, because some of these tumors won't. Others, we need to be more aggressive in things like surgery and radiation. There's hormone therapy and chemotherapy that's also done. Even some immunotherapies now that are being thrown in the mix. So lots of options out there. What are some of the common concerns and misconceptions? I'm going to try to clear those things up today. So people have the myth that, PSA testing always leads to unnecessary treatment. I probably would have said you might be right years ago, because we're finding that some of these early cancers really don't ever spread or grow. We shouldn't be probably be diagnosing those, but that's not the case anymore. Now we have better ways of kind of isolating whose elevated PSA is a greater risk and whose is not. So I'm going to do a little episode on that. I think next week is kind of round out and finish off our PSA thing with this prostate cancer screening risk assessment tool. I'm going to show you how that works and what it means. Again, all these tools, keep in mind, these are not perfect. They're just guidance. It's to lead you with a good conversation with your doctor. But PSA early testing does not lead to unnecessary test. Now, myth, prostate cancer only affects older men. Nope, it does affect high risk men. So things like if you're African American, if your family history, your brothers had it, your fathers had it, your grandfather, uncle, those things can make you a higher risk. So in conclusion, my recommendation is get tested. Why take the chance? It doesn't make sense to be afraid of a test. Prostate cancer can be silent. So it's important that you get tested because early detections is what saves lives. I'm just going to finish off with kind of a personal note on this, in that I've getting to the age now where I've had a few friends in their 60s that have gotten diagnosed with cancer. Unfortunately, they never got screened in their 50s. So when the time came along that they found out they had cancer, it really was already an aggressive disease because they waited for symptoms. You don't wait for symptoms. Prostate cancer, generally early caught, is not going to have any symptoms. I have a lot of patients that'll tell me that when they're getting their biopsy, I don't have any symptoms. I probably don't have any cancer, right? And I'm like, it doesn't necessarily mean that. It just means that you're here because you need to be here. So catch it early. Those guys, some of those have not made it, unfortunately. So I think that it's a warning sign to everyone. Be sure to don't be afraid to get screened. Talk to your doctor. Nowadays in medicine, everything is kind of a discussion rather than just jumping into here, you need this done. So anyway, we're going to try to finish out next week with that prostate cancer risk test. I think it's kind of a cool thing you can do online. We'll run through one of those and show you how that works. And in the meantime, be sure to check out our show at UroPatient.com.